Production funding for Behind the Headlines is made possible in part by the WKNO Production Fund, the WKNO Endowment Fund, and by viewers like you. Thank you.
How Memphis will reopen tonight on Behind the Headlines. I'm Eric Barnes with the Daily Memphian. Thanks for joining us as we continue to do Behind the Headlines remotely. I am joined tonight by Doug McGowan, Chief Operating Officer for the City of Memphis. Doug, thanks for joining us from City Hall.
Glad to be here, Eric.
Along with Bill Dries, reporter with the Daily Memphian. Doug, so let's start with, we're in this phase of potential reopening. And the city and county and the suburbs have laid out a framework, the back to business framework. There's a website that has a tremendous amount of information, backtobusiness.memphistn.gov. Who though is in charge? I understand, and we'll get into this idea that there's not a date, it's data, as the mayor said, and that it's a series of metrics that as we hit them, we can open more, and if we miss them, we have to kind of pull back. So we'll talk about that some more. But fundamentally, who's in charge of making that decision that we've hit the metrics you all have laid out?
Sure. Well, I think it's important to say that we've had a great cooperation of this coalition of mayors from across Shelby County and actually our region. Everybody is aligned and it has the intention of moving forward at the same time with the same kinds of restrictions in place and the same kind of protocols in place. And if you were to wind the clock all the way back to what the authorities are for each individual mayor, they all have an individual authority and could make their decisions on their own. The health officer could make his decision on his own. The governor has a certain level of authority as well. But what we're trying to do here is to have everybody look at the same data and come to the same conclusion and make their decisions together so that they use their collective authority for what we would say is a comprehensive approach to reopening Shelby County in the areas immediately around us.
Are you worried though that with so many people, elected officials with their own constituents, a tremendous amount of pressure from some people to stay closed, from other people to reopen, business owners particularly, and it's just a tremendously pressured situation, that collective decision-making will break down?
I think that's always a concern and that's always a risk, but I look at what people do rather than what could possibly happen. And so far we have been aligned. We've been at this for almost 6 weeks now, and we have had a consistent cooperation across all of the municipalities in Shelby County and even our surrounding counties in West Memphis, Arkansas, DeSoto County, Tipton County, Fayette County. We've had this collective effort, this coalition of the willing who are coming together to make sure we have the best possible outcome here in Memphis and Shelby County region.
Last thing before I go to Bill, that sense of, again, looking at the metrics, and we'll walk through some of those metrics and try to dive into them a little more, but that the measurement, the determination that all the various metrics have been hit on any given day, is that the task force getting together and saying, taking a vote, or is it that the numbers are so hard and fast that it's really, the numbers don't lie?
No, there's really no vote. What happens is every day we meet as a joint task force. We've moved those meetings to 3 times a week now. But on that task force call are all the representatives that I mentioned, in addition to the health department and so many other agencies. There's several hundred people on this call, including all of the hospital systems, the social network providers, the social service network providers, and all of the elected officials, as well as their staff members who are delivering the services each and every day. We understand that there is pressure, but that's just one factor that weighs into any decision. The data is the data. And so what we're really looking at is to have a flat or decreasing number of new cases each and every day. And we're also looking for a flat or decreasing number of COVID-related hospitalizations, particularly in our ICU. That is one data point that we will look at to determine whether we are ready to begin moving forward. But we also have to look at, as you've heard on the daily press briefings, we have to look at the capacity of our hospital system to be ready to absorb any kind of an uptick when we do decide to open up, and the capacity of our public health system to put enough testing in place and enough contact tracing, investigation, and surveillance capacity in place to make sure that we have our finger on the pulse and can tell very quickly if things move up. At the end of the day, this is a decision that the health officer and the elected officials have to make. There is no formula that says 1 + 1 = open. You really have to take a look at the data and determine, having balanced all of the factors that are associated with this, is it safe and prudent for us to take the next step and move into phase 1? There is no easy answer to that. There is no rote answer to that. It is an aggregation of the information that says we have mitigated the risks appropriately, and the next step is that we should move into phase 1.
All right, let me go to Bill Dries.
Chief, government and business and health do intersect, and they intersect quite often, but I venture to say they don't often intersect in this particular way. How unique is this moment in the life of the city, in the affairs of the city of Memphis?
Well, I think it's fair to say that it's unique globally, Bill. We haven't had something of this scale and intensity for more than 100 years, really. And so it is very unique for us in the city, I think, for the unprecedented level of collaboration, cooperation, and information sharing that we're seeing is something that is quite unique. The openness and willingness of everybody to partner, to drop their various perspectives and come together as one unified team is relatively unique, but it's also inspiring. Memphis is a city, as I've said several times, and there's a book that says, by Sir Peter Hall, that says Memphis is a city where anything can be made to happen. And quite frankly, this is the epitome of that. I don't know of any place else that has a joint task force that is organized like ours, that has the number of agencies that are participating and a unity of effort like is happening here in Memphis and Shelby County. It's something we can all be proud of. In this unique moment, we came together in the right way so that we can provide the best possible outcomes for our citizenry.
The city got some good news this week, $113.6 million in CARES Act funding from the federal government. But there are rules about how this money can be used, as is usually the case with the federal government. This cannot be used to fix the holes, the revenue holes that are coming in the budget, or the revenue hit that the city has taken in the current fiscal year. What's that money going to be used for? Well,
that's an excellent question, Bill. City Council took action just on Tuesday. As you said, we had a budget hole of about $100 million between this fiscal year and next fiscal year. That's what we have forecast, and we put out to the City Council. That's a problem that we need to solve. We were hopeful that the federal CARES Act money could help us with some of that. The restrictions that are on that money mean it is going to be very limited for what we can use it for in our city budget. It's literally for those extraordinary expenses that are over and above what we had already budgeted for. But there will be some of those revenues that we can use for those extraordinary actions that we took that we had not planned in our budget for this year that ends in July, and for next year, quite frankly. There is new work that we're going to be doing that our folks had not been doing previously and would be in place of the work that they were doing. So we're hopeful that we can use some of that money to help with our budgeting needs this year and next year, but it will not be a substantial portion of that $113 million. On Tuesday, City Council allocated $10 million, and rightly so, and we are very thankful for the cooperation between the City Council and the administration to do the right thing for our community. That will be a helpful inject of cash for our small businesses, which is predominantly the purpose of that money, as well as those social service provisions for additional food for our individuals in the community who need that, for additional testing capacity, we could use it for additional testing capacity, additional capacity for the health department. It's not just the city, the county also got an inject of some of those federal dollars. So together, we are well resourced to respond to the COVID pandemic, but it certainly does not solve our budgetary woes because it cannot be used for revenue replacement.
And the $10 million fund, as the council was moving toward that in some general way, you were also looking at a program that Chattanooga has, which is kind of the model for how the city is going to work on this. And as I understand it, it's a business stabilization program that in normal times has been used in Chattanooga for things like a street closure that affects a business or something like that. Is that kind of what the principle of this fund will be for Memphis?
Sure. We were asked, obviously, to look at that. We had been scanning for best practices or promising practices. Once the requirements, or excuse me, the rules came out for how that money could be used from the CARES Act. And so that was one of the practices we landed on. Quite frankly, I also speak with the other big four COOs on at least a monthly basis. And during this pandemic, we've been meeting each and every Wednesday afternoon to compare notes. One of the notes that we compared was how are you going to use the CARES Act money? And during that conversation, Chattanooga had mentioned that they had this business stabilization program. When City Council started talking about adding money for that, we quickly pivoted to try to get some details. I will tell you we are nowhere close to having the details of the application, but we will quickly get there. But it is a model, and it showed some promise and was effective in the Chattanooga context. So like many cities do, borrowing and adapting to your own context is important, and it's an easy way to get, rather than creating something out of whole cloth. We thought that would be a good approach. Can't say at the end it will be an immediate parallel or an exact copy. We will adapt it to our own context, but it's a good starting point for us.
Mm-hmm. And before I send it back to Eric, there's been a lot of infrastructure that's gone up. There is a for lack of a better term on my part, an overflow medical facility that's now at 495 Union that was built in a tremendously short amount of time. And other infrastructure. When this is over, or when the first wave is over, or we are significantly past this, do you think that some of the infrastructure from this pandemic remains and can be used for some long-standing problems that we have?
Well, it's a great point, Bill, and it does point to the uniqueness of the Memphis situation. So let me talk about physical infrastructure. In addition to the alternative care facility, which is at the old commercial appeal building at 495 Union Avenue, there is also some systems infrastructure that was put into place. So for instance, we have an EMS surge facility over at the fairgrounds, which is a unique and a first of its kind in the country as well. So that's a systems infrastructure that we'll be able to put back into place should we ever need that. And so we put that in our toolkit, and we'll carry that with us forward. For the actual overflow or the alternate care facility, that is unique across the country. Many of the other facilities, there have been 17 others built. There will be 26 total that are built, and ours is one of them. Many of them are in arenas, and once this pandemic is over, they will have to be disassembled and moved out because those are revenue generating facilities for those cities. Here in the city of Memphis, at that facility, there is a long-term lease, an 18-month lease. And so it will remain as an alternative care facility during the period of that 18 months. Should we see a second wave of this pandemic, should we need to respond in some other way, we will have that facility with us for at least 18 months. During that 18 months, we can decide what we would like to do with that long term. The terms of exactly how that lease will be terminated and who will pick it up have not yet been decided, but it does represent a significant opportunity for us here. They are approximately, yesterday at 10 o'clock in the morning, they were 45% complete. They had just started 2 weeks ago. Today, I anticipate they're approximately 50% complete. It will come online in the middle of May, and it will be an incredible facility, an incredible asset located just adjacent to the medical center. And so I anticipate that there will be a great use of that facility, irrespective of whether we put one patient in there from this COVID pandemic.
All right, and over to Eric.
When we go to, I'm looking at, Bill mentioned the business, using part of that $10 million for businesses, and it gets me back to the Back to Business website. If people Google, or search Back to Business Memphis, it should be one of the first things that comes up. And when I look at that, it's back to this sense of, you talked about testing and stabilization and capacity being good. How do we know as citizens or as business owners or interested people what we individually or collectively can do to continue to push these numbers? Because when I look at it, and this, and you're going to be annoyed with me, but bear with me. You know, I look at it and everything on, as we tape this Thursday morning, everything's green and yellow, right? All the indicators about, you know, daily number of confirmed cases, ICU bed utilization, all of it's green and yellow, which when you read the very helpful narrative that goes with it, it says when we're all green and yellow, we can go into the next phase, which in this case, we're in phase 0, we can go into phase 1. But we're not yet, because as you said, the task force meets, it talks, it makes those decisions. So how do we know as citizens and as businesses if we're doing enough to help keep these numbers where they need to be? I think that's, you know what I'm saying? That part still is a big gap for me.
Sure. I think it's a great point. We have done, I think, a yeoman's job of communicating clear information when, quite frankly, the way has not been clear. There's a lot of information coming at people from a lot of different venues. And so distilling it down in a way that people can understand, I think our team has done a fantastic job of that. There is always room to improve in that messaging so that people understand kind of where we are on that. So we are trying to put together right now a dashboard that will give everybody that single look that will say, I can do my own analysis of the metrics and I can see kind of where we stand. So that has been work that has been going on. Getting that in the right format that we can get out to everybody, I anticipate will happen in the next week or so. But again, it has been a lot of work, a lot of data analysis, a lot of behind the scenes, and getting that translated over into a way that clearly communicates where we are to the public, I think is something that will come to fruition very soon. I will say the daily press briefings that we have been giving, and that we went to 3 times a week, and now we're back to every day. We have increased that specifically so that people understand where we are. And you've heard Dr. Householder, you've heard myself, you've heard the mayors consistently say that, you know, here's where we are. We have reached a plateau. We have been on a slightly downward trend. Those kinds of things so that you all know where we are. I would like to just emphasize that, you know, 30 days ago or 45 days ago, we thought we might be in a very, very different place. And so we are very fortunate and blessed as a community that we have all taken this collective action so that we can be in this place where we are really on this tipping point of deciding whether to move into phase 1 or not. It could have gone the other way, like it did in some other communities where we had this dramatic uptick. The evidence is what the citizens are doing, the compliance with social distancing, the compliance with all of the orders is working to blunt this and to delay any kind of a surge that could come. And so we are at a really good point. And as you heard yesterday, we're within days of being able to make a determination about whether we should move.
Do you, I mean, this is speculative, but once we go into phase 1, and that, as you just said, could be days away, and businesses do reopen and people get back into some sense of normalcy, right? It's not every business opening. There's still a lot of distancing. There's still be mask wearing. There's a lot of in phase 1. But that the will on the part of all these various government entities, if there is a spike, if there is an increase in cases, to shut down, to take a step backward, that's going to be a difficult decision, because people will have, I mean, people are sort of, a certain number of people are bursting at the seams to get out, to get back to some sense of normalcy. Businesses want to operate, they're in desperate straits. If we go a couple weeks, how do you close them back down if it comes to that?
I think we have said from the beginning, the thought was it would be very hard to close things down and to restrict kind of the operations. Quite frankly, it's turned out to be harder the other way, is to determine what's the right time to open up. The data is pretty clear when you see an uptick that you need to take action. That's why we're monitoring the hospital capacity. We're monitoring the capacity of our public health system. So that we can be sure that we will have all of the information, that we don't have a spike in new cases or a new outbreak that we don't know about. That's what's critically important. I have heard collectively across the task force a will on the part of the elected officials and the health officer that should we see a dramatic uptick, that we will immediately put back into place the protocols that we had before. I think that the will is there and that will continue.
All right, let me go back to Bill for a couple questions.
You've also had a pretty unique response here to dealing with people who are homeless, who either have come into contact with someone who has the virus or who have the virus themselves. Is any of that solution, is any of that response pointed a way toward a better strategy after this pandemic for people who are homeless in our city?
Well, let me go more global than that, Bill. I think coming out of this, people are learning lessons that will stick with us for decades to come. The delivery of systems of delivery of services are forever changed in many ways. You've seen some inspiring stories about how people have pivoted their service delivery. I know in the city of Memphis, our emergency medical service has changed, and we have advanced the radar concept to try to keep the emergency rooms from being overflowing. We're sending doctors and paramedics on low acuity calls to get people to the care that they need rather than going to the emergency room. We think that's a practice that will continue. We talked about our EMS surge facility, should we, to keep, again, the EDs from being overflowed. Our Memphis Animal Services has really made a gigantic pivot. They have made such great strides over time, but now we're in the provision of service preemptively to make sure that we have a pet food pantry so that people don't get a desperate need. So we're answering people's needs before the safety net has to kick in. And the same thing here with homelessness. It's really sharpened our focus on the service delivery needs for our homelessness, for the homeless population that we have. The good news is we had many things in motion before this pandemic hit. As you know, we had talked about, and we're actively building out a homeless day facility, some expanded capacity for a women's shelter in the city of Memphis. So those needs have been amplified, and our responses, our focus has been sharpened on that service delivery for those populations to make sure that we can reach them when and where we need to. But there are many examples. We were talking just recently about this remote work model, and there was a worry about the lack of productivity, but we're actually seeing in some cases an increased level of productivity. So I think it's really going to change a lot of things, and it's not just the immediate responses that you're seeing. I think we're going to see fundamentally a shift in a number of ways of how we deliver services more effectively to those citizens who need those services.
What has the discussion been like, since we are a city with a National Basketball Association franchise and a city with a very unique month-long festival? What's the discussion been like so far about how to resume those large-scale crowd events?
Robust. We certainly know that that is a very special circumstance. You talk about getting back to business, that is part of our economy. Those are, though they are very large parts of our community, they are specialty kinds of businesses and events. And so it requires a detailed level of discussion, it requires a detailed level of controls to be put into place. It's just quite frankly very hard to assemble large groups of people when you still have a significant number of cases in your community. So it requires special detail for those areas where people gather. So it is an ongoing conversation. We are engaged with all of the parties that you might imagine in the city who put on those festivals or those sporting events. And it's an important part for people to know as they plan what can be done so that they can plan either the rest of their season or the festival, or are we having to move into the following year? So it's an important discussion for us.
And I'll throw it to Eric.
With just a couple minutes left, Doug, testing. We've had on both Behind the Headlines and on the podcast and the stories we do on Daily Memphian, talking to lots of different people, Christ Community and Church Health, various representatives of the hospitals. And by and large, testing capacity right now, we're not hitting it, right? I mean, we have more capacity than we're utilizing. Is it time for the city to begin to test more people with no symptoms? Right now, by and large, I think Church Health is an exception, but by and large, most places doing testing, you either have to have some kind of symptoms before you be tested. Is it time to broaden that net?
Sure. I think it's a great question. Certainly there are symptomatic people who are not taking advantage of the testing for a number of reasons. There may be distrust. People don't want to be seen as positive, and then they can't go back to work. There's a lot of reasons why they are not taking advantage of it. There may be just a simple lack of knowledge, and so we've tried to communicate that broadly. Our testing capacity has increased dramatically in the last several weeks. And so we do have adequate capacity to test those individuals who would desire to be tested who are symptomatic. But as you said, Eric, there is a good reason to test asymptomatic people. We're starting off with those people who are most at risk, the people who are working, who are actually employees in the hospitals and the nursing homes. Our hospital systems have been testing their frontline workers asymptomatically. They haven't gone through everybody yet, but they are doing that in a proactive manner to make sure that the healthcare workers are not, don't have the disease that they could pass on. I know several of our large hospital systems are a long way through testing their frontline workers. Our nursing home population and the employees of the nursing homes, we are pushing them to get tested asymptomatically. And many of the providers that are coming online, the Walgreens providers, there is a rubric that they are using that says, if you're symptomatic, please come and get tested. And then all the way down, if you're asymptomatic and a first responder, police, fire, healthcare worker, they will do asymptomatic testing. So before we go to more broad ranging asymptomatic testing, we want to make sure that we are fully meeting the needs of folks in the community who are symptomatic and those first responders.
The other big need as we go into these future phases, I think everyone agrees, is contact tracing. Your boss, Mayor Jim Strickland, was on the show a few weeks ago. Time blurs together for everyone right now. Talking the city had some capacity with existing employees to do contact tracing. But will the city be ramping up the number of contact tracing individuals it has? And could that federal money be put toward that?
Well, I'll answer the last question first, and absolutely, that is one of the reasons the federal money was allocated, was to pay for additional capacity. So Dr. Householder at the Health Department has conveyed to the Joint Task Force her needs for additional staffing. Obviously, as we open up, the folks at the city who have been volunteering and helping out over there doing contact tracing, and we've had a number of other volunteers from other agencies pitch in and help with that contact tracing, and we very much appreciate it. But when we get back to business, those folks may have to go back to work. So this is an opportunity for us to hire an expanded staff of permanent folks who will do that contact tracing for the health department or the contact investigations. And more importantly, equally important is the monitoring of people who've been put into quarantine. So she needs some additional capacity. The federal money can be used for that capacity. You heard Mayor Harris talk yesterday and said some of the federal money from the county will be used to plus up the capacity of the health department. And we fully expect that to happen and will be underway very quickly so that we do have that capacity there.
All right. Well, we are out of time for this week. I appreciate you joining us, and join us again next week, and stay safe. Thank you.
Thank you, Eric. Thank you, Bill.